everyone, welcome back to the Doctor's Discoveries. Today we're going to be talking about depression. I'm Ellen.
I'm Sharvi.
I'm Shanti.
And I'm Serena. So a little bit of background about depression. So depression or major depressive disorder is a widespread mental health condition that affects mood, behavior, and overall functioning. It's not simply a temporary emotional response to difficult situations, but a complex disorder influenced by a combination of genetic, biological, psychological, and environmental factors. Changes in brain chemistry, particularly involving neurotransmitters like serotonin and dopamine, are believed to play a key role. Depression can develop at any age and may be triggered by life events such as trauma, loss, chronic stress, or mental conditions, though in some cases it occurs without a clear cause. Globally, depression is one of the leading causes of disability and can significantly impact a person's ability to work, maintain relationships, and carry out daily activities. It exists on a spectrum, ranging from mild to severe, and may occur as a single episode or recur over time. Because of its complexity and variability, understanding depression requires recognizing both biological basis and influences of life experiences, as well as the importance of early identification and support. So, some of the symptoms that can be identified are persistent sadness, emptiness or low mood, loss of interest or pleasure in activities once enjoyed, changes in appetite or weight, whether it's an increase or decrease, sleep disturbances like insomnia or excessive sleeping, and difficulty concentrating on making decisions.
Yeah, adding on to that, like Serena said, depression is a mood disorder that makes someone feel very persistent feelings of sadness and boredom, which means you basically don't have interest in a lot of things, especially things that you used to enjoy. And people don't know this, but depression can lead to a lot of physical issues, not only emotional, which add up in the future, making your whole life get affected by depression. And adding on to the symptoms, someone with depression would be very sad and tearful, and people with depression say they feel empty or hopeless and have angry outbursts that are usually over pretty small matters or sometimes just randomly for no reason. Like Serena said, you wouldn't have a lot of pleasure in activities that you enjoyed before if you had depression, such as hobbies and sports, and again, a lot of sleep problems like insomnia. There are also a lot of random and unexplained physical issues that get caused from depression, such as back pain and headaches, and it's important to remember that these are really random and not from other injuries or actual diagnosed medical issues. Another symptom of depression would be suicidal thoughts, or having emotions and feelings of guilt which fixate on past failures and constant self-blame. You can also feel very anxious and restless if you have depression. But also, it's really important to keep in mind that depression causes noticeable problems in everyday activities, and it takes up a whole person's entire life, and it is a really, really big deal. Because a lot of people, anxiety is a very common mood disorder, but it's not as big as depression, so often people misdiagnose themselves with depression. But when you do actually have depression, it's important to understand that this mood disorder consumes everything you do. Adding on to this, there are also multiple causes of depression. Depression is caused by, just like many other mental disorders, a variety of factors that play into it, such as biological factors, which is when someone who has depression's brain would look different than someone who doesn't, such as physically, it would have physical changes. And another cause would be by inherited traits, where it's common to have a depression if you have lineage or blood relatives who also have the condition. And another thing that plays into depression is having different hormone changes, such as a changed balance of hormones in a body, which can trigger depressions. And this, for example, would be from pregnancy, menopause, puberty, and also postpartum.
Yeah, I think it's really important to highlight that depression isn't just being sad. There's a lot of biological changes happening in your body. So specifically in terms of chemicals, we have this thing called serotonin, which is also known as the happy neurotransmitter. And serotonin is often linked to mood regulation. But chronic stress can lower serotonin levels, and low serotonin activity is linked to depression, higher suicide risk, and even SAD, which is called seasonal affective disorder. So basically, sunlight helps keep serotonin levels higher, and it does this by decreasing serotonin transporter, which is SERT activity. But then SERT normally takes serotonin back up after it's released. So if SERT activity is low, more serotonin stays available in the brain. But in SAD, seasonal affective disorder, longer nights can increase SERT levels, and that means that there's less active serotonin in your mind, which gives a higher risk of depression symptoms. Also, another chemical in your brain is dopamine, and it's a motivation chemical. But dopamine is not just about pleasure, it's strongly connected to motivation, goal-directed behavior, and habit formation. So low dopamine can make people feel less driven to work towards goals, which is a really important symptom of depression, like Ellen mentioned. Also, people with clinical depression often have higher levels of monoamine oxidase, which is also called MAOA. And basically what MAOA does is it breaks down important neurotransmitters like serotonin, dopamine, and this other thing called norepinephrine. So if MAOA levels are high, neurotransmitter levels can become very low, and this can actually worsen depression.
So there's like also some treatments. So just to name a few, there's psychotherapy, which is like cognitive behavioral therapy or like talk therapy. There's also antidepressant medications to regulate brain chemistry. There's regular physical activity. You can just like, if you have regular physical activity and exercise, it can like improve like happiness levels and stuff. And then if you get healthy sleep habits and have a structured daily routine, then it can also help. And of course, you can also just get like social support from friends, family, or support groups. Sharvi, do you want to add a little like more?
Yeah, definitely. So there's a lot of like different treatments like Serena mentioned, but to be more detailed on like antidepressants and how they work, there's these things called selective serotonin reuptake inhibitors, which are SSRIs, and they're basically common antidepressants like Prozac, Zoloft, Paxil, and Celexa. And basically what they do is they block serotonin reuptake through SERT, which I was talking about a bit earlier. So basically what this does in general is that it leaves more serotonin available for signaling between neurons. And then another one is ketamine, which is a fast-acting treatment, and it's an anesthetic actually, and an NMDA receptor antagonist. So it can literally reduce depression symptoms within hours. And this is important because most antidepressants take weeks to work. So it may help people with major depressive disorder who don't improve within standard treatment. But long-term safety is still not fully known, and it was not approved specifically for mood disorders. So some clinics still use it off-label. So also standard treatments don't work for everybody because older theories focused a lot on chemical imbalance, but that helped scientists create antidepressants. But this idea is basically incomplete because around 30 to 40% of depressed patients don't respond well to standard antidepressants. So this kind of just shows that depression is more complex than just low serotonin or dopamine. There's so many layers to the disorder. Shanti, do you want to talk about postpartum depression?
Yeah, so there are so many layers and there's also so many different types. So one of them that I'm going to talk about is postpartum depression, and basically that happens when people have mood swings, but those are it's mainly after you're after you give birth to a baby, and usually it's normal for people to have mood swings or just unstable mood for up to 2 weeks after delivering a baby. But if it lasts longer than that, then you can be diagnosed for postpartum depression. And this usually, it's a super serious disorder, and it usually leads to difficulty bonding with the baby, or you just it's depression, you don't have interest in activities or stuff like that. And it's a lot of women are affected by it. So
approximately 1 in 9 women are affected by it after birth, which is a lot of people. And there are some like different causes that there's no like specific cause, but there's some different ones that could cause it. And one of the main ones is like when your thyroid levels drop. And what that means is like the thyroid hormones manage your energy, and then when they drop, the energy levels do too, and then that leads you to like express depressive symptoms and exhaustion. And this is because like when you like give birth, your thyroiditis gland is inflamed, and then when that gland becomes inflamed, it's followed by like a longer underactive phase when it's like not inflamed, but its usual function is not where it should be. And then those like hormone levels are dropping, and the body moves into a hypothyroid state, and that just causes your energy levels to drop and leads to fatigue, depression, and cognitive dysfunction. But you can take like a blood test from your doctor to determine if that's like actually the cause, because like I said, there's so many different causes, like hormonal changes, or also history of depression like before you got pregnant, or if you have like limited support, high stress, or difficult pregnancies. And I thought it was really interesting because postpartum depression is actually increasingly common in women who are denied the right to an abortion compared to those who receive one, because they have to go through like the stress of like having like the baby, even though they know that that they might not have like the circumstances or like resources to support the baby. So just like stress and like situations that like where you don't have a lot of support can cause this a lot. So it's important to like just like know like the reasons why you can have it. But yeah. Sharvi, do you want to talk more about the gut health?
Yeah. So there's like so many different layers to depression, and a new one that's being researched is this thing called the gut-brain axis. And basically it's this two-way communication system between the gut and the brain. And there's like the vagus nerve, which acts like a direct hotline between the gut and the brain. So it like connects the two. So gut bacteria actually has the power to influence brain function, mood, and even response to antidepressants. So basically the way it does this is through this process called dysbiosis, and it's imbalance in gut bacteria that can actually increase risk of depression. And then there was actually this study done where rats were given microbacteria from depressed patients, and those rats actually developed depressive behavior after they got that gut bacteria. So basically the vagus pathway, the SSRIs and certain probiotics rely on the vagus nerve to improve mood. So experiments show that if the vagus nerve is cut, SSRIs and beneficial probiotics don't work in mice. So this highlights that the gut-brain communication is essential for treatment effectiveness. So I guess the key takeaway is that your gut health can actually really affect your mood, and beneficial bacteria can improve mental health by producing neurotransmitters and reducing inflammation. And the vagus pathway is like, it's like a highway kind of connecting your gut to your brain. And future treatments may actually focus on modifying gut bacteria, not just taking pills to help treat depression.
I feel like it's so interesting that there's so many like different causes for like this like one thing, and literally like anything can kind of like cause it at this point. Like we didn't even discuss all of the causes as well. Like there's so many more.
Exactly, yeah.
Yeah, I agree. We want to show you that emergency help is always here for you, no matter what, if you're struggling with any mood disorder or any mental health issue. So you can call services such as 911 or suicide hotlines like texting 988 to reach Suicide and Crisis Lifeline, which is available 24/7, or call 1-888-628-9454, which is the Suicide and Crisis Lifeline in the US that also has a Spanish language option. And that basically sums up our whole episode today about depression. Thank you for listening. I'm Ellen.
I'm Sharvi.
I'm Serena.
And I'm Shanti. Just a quick disclaimer, this podcast was researched and created by high school students, so not everything will be completely true.